When the pandemic hit, the Commonwealth Fund Fellowship had already been training leaders in minority health policy for more than 2 decades. By then, more than 140 fellowship alumni, 100%, had been actively engaged in aspects of policy, research, and/or service delivery related to minority health and/or public health. And a significant number have assumed leadership roles in federal agencies, state, county, city departments, and/or in national and regional organizations and associations. No one could predict that the pandemic would strike when it did, but we knew that a crisis like this would worsen disparities in our healthcare system, and the Commonwealth Fund Fellows were ready to respond. This is what we had prepared for.
What I remember from that time really is just the profound uncertainty. I remember not knowing what direction we were headed in, looking at Italy, looking at New York, wondering what was coming our way.
Having a public health lens and having an understanding of how to protect the public is very important in the delivery of care, because it allows everyone to think about all of the paths and the levers we need to pull, the paths we need to take and the levers we need to pull in order to maintain a sense of order and elevate health for everyone.
So the fellowship had a way of training me to think bigger and higher than what the issues might be happening at that moment. And so for an example, as Chief Diversity and Inclusion Officer, I was thinking through COVID and how it impacted our patients, but also how is it impacting our underrepresented in medicine faculty and trainees and students.
From the very beginning, there was a disproportionate burden of cases, hospitalizations, and death amongst Black and Indigenous people of color, and the disparities seemed to widen as time went on. The fellowship certainly provided me with a network automatically of experts as it pertains to how to address disparities in care and outcomes amongst underrepresented or minority populations. It also demonstrated to me, or helped me to better understand how we can meaningfully partner with people, whether it be folks in our community, whether it be organizational leaders from grassroots to corporate, or whether it be our civic and government officials to enact change.
And if it wasn't for the fellowship, I don't know that we would have made progress in some of the public health actions we were able to take, building epidemiological data, making sense of what was going on and helping people who are in dire need. The fellowship, is an incredible community of people that even to this day continue to do things to address the pandemic and think about how do we, recover, rebuild, have resiliency, and reimagine the future so that we're not in this position again.
I want people to stop talking about health equity just with like-minded peers in an academic space and really start to have this conversation amongst their friends, in the beauty shop or at the barbershop or at the PTA meeting and that type of thing, because that's really how we affect change. We have to talk about it with people who don't look like us. We have to talk about it outside of the healthcare space.
We're really at an inflection point. This is a window of opportunity for change. So then how do you harness that opportunity? How do you use this as a chance to finally address structural racism, achieve health equity in a sustainable way? And I would say, what could possibly be more important right now?
Even though we're trying to address the issues related to COVID-19 and the pandemic, the other healthcare inequities that were present before the pandemic are existing through the pandemic and will last beyond the pandemic. So I think that our fellows are uniquely positioned because we've been thinking about health equity and health policy for years, and now we can apply our lessons learned through the lens of a pandemic, focusing in on addressing those health inequities that other leaders may not be thinking about because they may have other areas that they're trying to focus in on. And I think there are opportunities for the fellows to step in and to lead in the spaces where leadership is lacked. And I think that's one of the fundamental strengths of the fellowship is people are given the tools for success.